University of Ottawa. So, Raywat, good afternoon to you. That's pretty positive news today, forecast from Dr. Tam,
It is.
saying that it's quite possible we'll be able to socialize outside this summer if 75% of us are vaccinated, 20% are fully vaccinated. What do you make of that projection?
Well, I think the projection is conservative. I think we'll probably be able to do many of these things a tad earlier than the projection state, and it's an important message to give the public. There's a lot of doom and gloom out there right now, which is mystifying to me a bit because all the projections show that we're actually trending in a good direction. Even though we're in crisis right now, things are getting better every day, and all the models suggest that we'll be out of this sometime this summer. And this will be the last lockdown we experience, assuming we do everything right. And I think we will do everything right. So I think as well that this model, this roadmap, was presented in response to the CDC offering a similar infographic showing what vaccinated people can do. And there's some outcry about why does Canada not have similar guidance. So this is an attempt to answer that question. But there are some caveats here. So attaining 75% vaccination, is that reasonable? I think it is. Surveys suggest that 75 to 80% of Canadians are eager to be vaccinated, but some anecdotal evidence from doctors' offices suggests that vaccine hesitancy is real, and we're going to have to be up against that at some point this summer. And the other metrics we haven't talked about include things like the hospital capacity. The ICUs are still being overused and will continue to be overused well into the summer, probably. So it's probably not a good idea to be too lax while that hospital crisis continues.
Yeah, and it's interesting. You said something there about, assuming we don't, that things are going to follow this trajectory, and you think that these are reasonable goals, assuming we don't sort of blow it, reopening too soon, and so on. And that's an interesting assumption, isn't it? Because we're now coming through and hopefully out of the third wave, but so we've kind of done this three times. What makes you confident that we will navigate the rest of the way forward to this fall of being back together, even indoors, properly?
Three reasons. First, I'm a stupid optimist. So I see we've done this twice already and we've opened up too soon. I think this time we learned our lesson, hopefully. Second reason is we have a tool that we didn't have before. That's vaccination. So the cases are dropping because of the restrictions we put into place, but we're vaccinating on top of that to hold cases down, and it looks like people are eager to get those shots. And the last reason is that there is a genuine exit ramp now, and so there is an expectation that we do this right. We've seen other countries show us how it's done. Israel, possibly the UK, places like that where they have used vaccination to get a semblance of normality and are staying normal. So it looks like it is possible. Therefore, whatever is possible, we can do. And I think we are eager to do the right thing.
It's funny, we've spoken a lot on this program about public health messaging and how unclear and inconsistent it has been generally when it comes to COVID-19. So this roadmap from the federal government, Dr. Theresa Tam, what is the value in having that plan clearly articulated, those goals clearly laid out in what is essentially, as you say, kind of a positive framework?
Yeah, no, I'm not really sure there are goals here. It's more, here are what the indicators we look at that we link to the activities that we can possibly do when these indicators are achieved. And obviously the individual provinces and territories must enact their own policies to reflect this roadmap. This is not policy, this is simply guidance. So the value here is in showing that the end is near. And that message really has not percolated as much as it should. Most of the messages I get from the public have to do with, when will this be over? This is interminable. I can't live like this. When in fact, the end is near. It's just the question of how far is the finish line. Is it 5 kilometers or 50 kilometers? And do we want to sprint there, or do we want to take our time and make sure we get there, healthily? So the value is in showing that the government understands that there is a trajectory to normal and that people have a thirst for guidance. Now, there's a balancing act here because you must be clear and consistent. At the same time, you can't be overcomplicated, even though this is a nuanced message requiring some complication. So I'm sympathetic to their plight.
I also want to ask you about a new study. So Canada's policy of delaying that second dose of the vaccine, given that we didn't have enough to vaccinate everyone according to the original schedules put out by the pharmaceutical companies at the outset, that policy came under a lot of scrutiny, but this new study has found now, the study that just came out last night, that there are actually benefits to spreading out the first and second dose of vaccines, and perhaps an even better result than doing it on original schedule. Tell me a bit more about what that study found.
Right. So there are three big takeaways. One is that extending the interdose interval is not necessarily dangerous. That's very important. That's probably the biggest takeaway. Two is that it might even be better, as you mentioned. So those who got the dose delayed up to 3 months, 12 weeks, I think it is, saw antibody production 3.5 times those who stuck to the original randomized control trial recommendation of 28 days. And the third thing is that this was done in a really elderly population, those 80 years and above. And that's a bit surprising because the concern was that this population would suffer something called immunosenescence, meaning they're least likely to have an immunogenic reaction to a vaccine and would need to stick to the randomized control trial schedule. So this kind of throws that out the window, maybe. I mean, it is a small trial. We looked at about a couple hundred people, and it hasn't been peer-reviewed yet, so there might be some flaws in this. But I take a lot of good away from this. Now, the further caveat, in addition to the one I mentioned, is that the T-cell response was less in the group that had the extended interdose period, and that the T-cell is the other arm of our immune system that's more in charge of longevity of reaction. Now, that sounds troubling, but they found that after several weeks later, both groups looked the same in terms of T-cell response. So to summarize, the groups have different immunogenic reactions, the regular delayed dose versus the extended delayed dose, but after a few weeks, they both look kind of the same. And my takeaway is this means our decision to delay that second dose will not result in anything bad.
So is it going to impact our schedule at all, do you think?
It's a good question. Now, this only tests for 12 weeks, not the 16 weeks that we are pursuing. So maybe there will be a temptation to reduce our 16-week schedule down to 12 weeks. I don't have a lot of faith in our data processing infrastructure to allow a change right now, because people have their second doses scheduled, and suddenly they've been told, hey, we're moving that up a couple of weeks. And also, it's confusing to people to have that date keep on moving. So I don't expect a lot of change to happen right now. Keep in mind, though, that we're having an influx of a lot of vaccines coming soon. If anything, I expect the return will be to the randomized control scheduling, which is 28 days, because that's what people know. But it's difficult to predict what people will do, what the policies will mean. This pandemic has thrown us a curve at every turn. So I'm crossing my fingers and biting my tongue. I'm not sure what's going to happen next, but it's a day of good news. This is good news that we should celebrate.
Well, I'm pleased to speak with you about it. Thank you so much.
Thank you.
Raywat Deonandan.